So you're ready to start your journey to learn echocardiography.
Or to the
This was
demo.
really good. It only takes 10 hours to learn how to play the guitar. You don't need talent. All you need is passion and the will to learn, and especially a good training program. Now, you are in the right course. We're going to teach you echocardiography. But maybe someday you'll be the Carlos Santana of echocardiography. In any case, we're going to provide a teaching program for you that will help you master the difficulties of learning echocardiography. And with me, I have Dr. Anna Maria Prestretto from Italy, who, together with me, will guide you through this course.
In the starter kit, you've learned how to image from the most important windows, the parasternal, apical, and subcostal windows. And you've learned about the main views. We've used the parasternal short axis to assess left ventricular function, together with the apical four-chamber view and the subcostal view. And you've learned to assess aortic valve and mitral valve with the long axis view, parasternal window, and short axis view at the base. Now it's time to dig deeper and show you the secrets on how to image.
But before we do so, we have to take a look at the scanners, at the workhorse that we'll be using. I'm frequently asked, which scanner should I buy? It's not very easy to decide because there are hundreds of different models out there. But the question, which scanner, is the same as which tennis racket I should buy or which car should I drive. Now, if you want to buy a tennis racket, it's probably more important that you know how to play tennis, because if you can't hit the ball, it does not make a difference which tennis racket you use. And the same is true also for the car. It depends where you want to drive the car. Are you going to drive it in the city, maybe somewhere in the outbacks, or maybe you want to drive on a race circuit like Le Mans? The same is true for ultrasound scanners. Decide first what you need it for. This, for example, is a scanner that is used specifically for cardiology. It's a high-end cardiology scanner. Of course, you can also use it for abdomen and other image modalities, but that is what it is designed for. A high-end scanner that gives you all the capabilities and sometimes even more. Here on the other side, you have a scanner which is a mid-range scanner. It allows you to perform ultrasound of the abdomen. You can do carotid scanning or vascular scanning, small parts. You only need to plug on different transducers. You get all the different other modalities. Here we have a smaller machine, which is a semi-portable machine. You see, down here there's no technology anymore. It's only a cart that carries the scanner. You can even take it in your hand and walk to the patient. So this is very convenient if you need mobility. But if you need very big mobility, or if you want to have something for your pocket, there is another scanner you can use. This is a so-called handheld scanner that you can definitely only put in your pocket. You can use it for cardiac scanning, for abdominal scanning, and on the transducer you have actually two sides. One side is a phased array probe, and the other probe is a linear probe. So for vascular and cardiac, this is ideal. This is, of course, something that I could recommend for people who want to make point-of-care echocardiography.
Yes, point-of-care echo is a hot topic. For sure, portable machines can facilitate this, but there are many machines out in the market.
Yes, it's true. And if you want to classify them, there's a so-called semi-portable ones, which are like a laptop. But then we also have the true handheld machines. But where do you think this is going to go, Anna?
Well, I think one day we will only have a transducer, we will plug it into our phone and then put it in our pocket.
Yes, and maybe even wireless. And I think all this goes in the direction of using, I would say, the ultrasound as a new stethoscope. And this will definitely change our landscape of medicine. But I think the question that we now have to ask is, how do we use such a portable machine? Anna, can you show us?
Of course.
You may ask me, what are you doing? Well,
I'm doing an echo course, and my echo machine is right here. As big as my hand, it's actually called handheld machine and gives me really high quality. I can complete my exam only with this small machine. This machine allows you to have good image quality, to add color Doppler, for instance, here in my personal long axis view, and also to take some measurements. So I will go to menu, distance, and this is the way you would, for instance, measure the aortic root. The only thing it doesn't have is spectral Doppler. But still, I think when you compare this machine with your stethoscope, it gives you more and more information. And from the handheld machine to the standard scanners, let's see what the components are.
Let us now look at some of the scanners and what the similarities, differences are, and what I think is important. Well, all of the scanners have a screen, usually a flat screen, at least in the modern ages. Then they would have a keyboard, which has a trackball, usually somewhere in the center. Then around the keyboard, around the trackball, you would have certain buttons that encompass the main features you'll be using very frequently, such as 2D imaging, color Doppler imaging, and spectral Doppler imaging, or M mode. Most machines have a so-called time gain compensation, where you can adjust the gain in certain regions. And a good feature is also a so-called touch display, which allows you to hide certain menu points behind certain buttons. You might not always need all the buttons, and thereby you can hide some of them to not make the machine look crowded. All the machines have some form of adapter where you can plug the transducer on. Some have 3, some have only 1, and some have 2. And what you can also find is a printer, which you can connect to the machine, which is important because thereby you can record certain images, still images, and measurements. Still, if you want to document a full study, a printout is not enough. You have to use the image function the systems have and the digital storage the machines have. So an important feature is the mobility, but it's also very important that the machines boot quickly. Especially if you work in an emergency setting, you don't want to wait for hours until the machine finally boots. So that has to go quickly. And equally important is the possibility to have a battery inside. That allows you to unplug the machine and move the scanner from one bed to the other without interruption. These are some of the features that I really like about the machines. Of course, if you want to buy a machine, you have to go to your representatives and test the machines on the patients and see what you like best for your certain environment and what fits your needs. What are some of the features that make a high-end machine a high-end machine? Well, a lot of the technology is right here in this transducer. It's the way the transducer creates the image, the beamforming, and how it is processed, how many elements you have in the transducer. This is a fascinating technology because remember, you have a lot of information coming from the transducer down into the scanner. And in modern scanners, you have a lot of the information already being processed within in the transducer. Then you have a number of different features within the software here which allow you to use it in different situations and which you have a lot of analyzing packages and stuff like 3D or speckle tracking or tissue Doppler. All these things are add-ons that make a high-end machine a high-end machine. And of course, the more expensive the machine in general, the better the image quality is. But don't forget what I taught you right at the beginning. It's more important that you have the driver license to perform echocardiography before you have a good car, such a very expensive scanner.
But don't worry, in this course we will help you to get the driver license for echo. And as the first step, let's see how to optimize the image.
Well, this is obviously not a good image, and there's a lot you can do to improve the image quality. The first thing that I would do in this case is I would optimize the depth. Now we want to see the entire heart, so we have to have the entire heart into our sector. You see, this button here tells you how deep you penetrate into the body, and you have a scale on the sector that tells you how far deep in the body you are. This, of course, would not be ideal either. So you should have a setting where you still see the heart and a little bit of the surroundings, because you can have pathologies there as well. The next thing that I would optimize here is the gain. The first thing that you see is that you have a lot of brightness here in the distant far field and not enough here in the near field. Why is that so? Because the so-called time gain compensation is not optimized. How do you do it? Well, you try to put the time gain to a midline and then maybe adjust where you think you should and decrease, in this case, in the far field. And then you take the so-called overall or main gain and you decrease it so that you still are able to distinguish different tissue characteristics within the myocardium, for example. The pericardium should always be the brightest echo you have. And you should try to see that you have a good expansion throughout the gray ranges so that you have this good differentiation of different tissue characteristics. The next thing that you would have to optimize here is the so-called sector. The sector tells you how wide the triangle basically is, and you can set it if you want to all the way to this here. Now you might say, well, why don't I leave it like this all the time? Well, the disadvantage is that your frame rate drops. You should try to also keep your frame rate high and thereby keep the sector as large or as small as possible. So this would be an optimal setting. And then what else do you use? If, for example, you want to look at the mitral valve, you would have the possibility to use the so-called zoom function. The zoom function focuses on a certain region. You can actually change the sector of region. And within this region, you then have both a higher spatial and a higher temporal resolution. Another very important feature of the machines is the so-called image review function. How do you activate it? Very simple. You simply press the freeze key. And then, with the help of the trackball, you can retrieve all the images that are in your storage. And this allows you to look at the motion of structures in slow, or actually in super slow-mo. Now, aren't these terrific images? I mean, do you think you can get something like that with MRI?
Well, to tell you the truth, I think echo is really superior in terms of frame rate.
Yes, I think this is one of the biggest advantages. There's no other imaging modality which can even come close to the image resolution, to the frame resolution that you have with echocardiography. So these are some of the most important features of the machine. Of course, there are many others. Many of them you will never use, but these you should know. But one more feature I want to show you, something that is often neglected, the screen. The screen is so important. You have to adjust the screen just as you do the image, because you want to have the background black and you don't want to have the contrast of the image too high, because it kills your eyes if you work in a dark environment. So keep this in mind. No matter which machine you're using, all of these features are always present. And while we go along, we're going to add new and new information so that you will really know how to use the scanner.
So let's summarize now some of the things we showed you.
Here, for example, would be the same patient, the same image with different gain settings, from a very low to a very high gain setting. Now, I guess you will all agree that this is probably too low and this is too high. The best quality would probably be here, or maybe somewhere in between these two. So here you're losing information, and here you are blurring the image. This is the influence of depth. Now here you have a depth which is very deep. You have the heart somewhere up here, and you're kind of wasting the sector. While here you only see the ventricle and not the atria. This might be a good view if you want to focus on the ventricle, but you're not going to see the atria. So here, again, you have to adapt to what you want to see. Sometimes you want to have the whole heart in your field of view. Sometimes you only want to have a portion in the field of view. And sometimes you might want to look at structures outside the heart. In this case, this would be the ideal image. And finally, if you look at the image characteristics and different settings, you see that the characteristics of the image varies depending on the frequency we use. The higher the frequency, the finer the image, but of course you lose penetration, and if a patient is not good to image, then the quality might not be as good as you would like to have it.
And here are 4 images showing the influence of contrast. For instance, the first image has a high contrast. The other one on the right bottom has the low contrast. Personally, I prefer the last one, because you can really see all the structures inside the myocardium, while when you use a high contrast, you lose some information. And now color Doppler, probably the most important feature of every echo scanner, together with 2D image.
Yes, Anna, I agree completely, but there's been some discussion if point-of-care echocardiography should include color Doppler. Now, I personally believe yes, because it gives just so much information that you need in critical care situations. But before we go further, let's explain what color Doppler actually is.
Exactly. Color Doppler is a modality of imaging which shows flow within a sector. And here, for instance, we are assessing flow across the mitral valve. As you can see, we have a red component which approaches the probe, and here is the location of the probe, while the blood which goes away from the probe has a blue color.
Right, so we can encode the direction of blood flow, but on top of that, also the velocity of blood flow. We have a scale here that depicts this. So the higher the velocity is, the lighter the color will be. So higher or lighter shades of red will indicate higher blood flow velocities. And then in some scanners, you even have a scale where you can kind of quantify or look at the turbulence flow, the variations in flow within a certain region. In this case, it would be greenish. But if you look at this jet here, in a patient who has mitral stenosis, you see that the center of the jet has a lighter red color, which means that the velocity in the center of the jet is higher. Now, if you put all this information together in this specific patient, we see that there is not only a high velocity across the mitral valve, which means there must be stenosis, but then if you look closely, there's also a bluish color here that in essence is
regurgitation.
Right. So the information you get from just this small sector is just enormous.
And here we have another example. This is a TE study. And as you can see, we have a mixture of colors. And this means the flow here has a high velocity. And this is what we call aliasing.
Right, and this aliasing is a phenomenon which comes to our advantage because it kind of highlights the jet. And obviously we know that the jet must be going in this direction anyway. So the direction of blood flow information is not important in this image, but it really kind of points out where the jet is and makes it easy to see. And if we now look at this systematic of the heart, there are so many places where we want to have flow information. It's not only at the valves to detect regurgitation, as for example here at the mitral valve or even the tricuspid valve, but it's also in the vessels and everywhere where we have flow velocities or pathologies. That's where we'll be looking at the color Doppler. Here is another example of a mitral regurgitant jet. Again, you can see that there are different components of the jet. We see that there is a proximal portion right here. This is actually flow acceleration already even before the regurgitant orifice. That is something that we'll take a closer look at when it comes to quantifying mitral regurgitation.
And this is another example of mitral regurgitation. So we can detect the jet coming from the left ventricle inside the left atrium, and we can even follow the direction of the jet, which here is impinging into the wall of the left atrium. In this example, which is really interesting, we see three jets. One is the mitral regurgitation, the other one is the tricuspid regurgitation, and the third one actually depends on the fact that the patient stabbed his heart with a knife, causing a tear in the right ventricle and then a hole in the interventricular septum. And this, what you are looking at, is a ventricular septal defect, which of course has a flow coming from the left ventricle into the right ventricle during systole.
So imagine if you have this patient in your clinic and you want to diagnose this problem. Without color, you cannot detect the problem. So far, we've seen a patient with mitral regurgitation, with tricuspid regurgitation. We've seen a ventricular septal defect, and here is a 5-chamber view to display that we can also detect aortic regurgitation. There is a small jet that comes from the aorta and flows right into the left ventricle. And as a last case,
we have a case of tricuspid regurgitation, and I'm sure by now you can all appreciate where the jet is.
But color Doppler is not the only way that we can display the flow of blood. We can also do this with the help of spectral Doppler.
When you want to measure flow velocity, you have to use the Doppler. You have two possibilities. You can use the pulsed wave Doppler or the continuous wave Doppler. Later on, you will understand when to use what, but now I will teach you to use the pulsed wave Doppler. So first of all, I recommend you use the cursor. You place it right where you want to measure flow velocities. Here, I'm putting it just below the mitral valve. And you press, as simple as that, the pulse wave Doppler key. What you get is a spectral image. These curves here, which come towards the probe and during diastole, cannot be anything else but mitral valve inflow.
So to understand how spectral Doppler works, just think of the way a tachometer works in, for example, a truck. What we're recording here is the change of velocity over time. Now, if we look at a spectral Doppler tracing such as this, what is the information we get?
So actually, we see flow which goes away from the transducer, and during a certain time in the cardiac cycle, this has to be aortic stenosis.
Yes, because we have the color Doppler placed across the aortic valve, and this occurs during systole. And what about this spectrum?
We have another example, but here the flow is coming towards the transducer, and when you see where the cursor is, it is registering the flow coming inside the ventricle.
So this is mitral inflow, showing the early and the late peak of diastolic flow. Look, when it occurs here in diastole, we have the ECG on the bottom here. And then finally, another spectrum. This time we have the cursor across the tricuspid valve. So what can this be?
Yes, it's again a flow which goes away from the transducer, so it's below the baseline, and this is tricuspid regurgitation.
Yes, definitely. So in summary, what are the things that we'll be looking at? We'll be looking at the velocity profile, maximal velocities, for example. We'll be looking at when what occurs, so the timing of the curve, and we'll look at the shape of the spectrum. As you will see, spectral Doppler is extremely powerful because it will allow you to assess the hemodynamics of the heart. We can look at the pressures in the heart, we can quantify lesions. So in summary, there's a number of different things that you can do with spectral Doppler. Assess cardiac function, for example, cardiac output. Look at valvular disease, quantify aortic stenosis. Assess diastolic function, quantify pulmonary pressure, we'll talk about that in the chapter on right heart disease, and even assess congenital defects.
So remember, you have the continuous wave Doppler and the pulsed wave Doppler. There are reasons why you should use the first or the second, but when you start with echo, you will be using more often the continuous wave Doppler. Why? Well, this is the one you use when you want to assess high velocity, and you will be diagnosing aortic stenosis, mitral stenosis, or pulmonary hypertension.
I have to show you one last modality. Do you recognize what this is? This is echocardiography, but what we see here is only a very small part of the ventricle moving. A line that actually goes right through the short axis view of the left ventricle. What I'm showing you here is what we call the M mode. Now, traditionally, we display the M mode in such a way that this line here is depicted along a timeline, right? So here you would have the timeline, and you see what happens to a certain regions of the heart where you place the M mode over time, over the cardiac cycle. Now let's correlate this with the moving image of the 2D right here on the right side. Now you'd have the M mode placed right through here, and you would kind of track the motion of the septum here. So you see during diastole it moves outward, and during systole it moves inward. And the same with the ventricle, which is the black part here, and the posterior wall, which is this right here. Now this is a way of displaying the motion actually on one picture. What is it good for? Well, it has a very high time resolution, which allows us, for example, to perform measurements. You could, for example, look at the diameter at diastole or at systole, but these are things that you learn in the masterclass. In essence, M-mode is an old method, but it still has its place. Now let's take a look at how it works. When you perform an M-mode, first of all, you have to figure out where you want to use it. In this case, I want to show you an M-mode across the left ventricle. So first I need the left ventricle. I'll use a parasternal short axis view. And then I hit the M-mode button and I try to optimize the M-mode here in the small little 2D image on the top where I want to have it. In this case, right through the middle of the left ventricle. So the upper part of the screen is kind of the reference image, and down below you see the actual M-mode. Okay, so it's very important to observe what is happening with the cursor so that you know you're really in the ideal position. Here I think I have a relatively good image, and then I will freeze the image, and here is the M-mode I get. Now you can do a lot with the post-processing or with the buttons after you acquired the M-mode. You could change the sweep speed, or you could even change, in some machines, the compression and other things. So where are examples where you can use M-mode? Through the left ventricle, as I just showed you, through the aortic valve, or you can measure the excursion of the mitral annular plane or the tricuspid annular plane. All of these things we'll show you in some later chapters.
And now let's review and show you what M-mode allows you to do. It allows you to measure, for instance, as shown here, the diameter of the left ventricle during end-diastole, or the thickness of the septum during diastole or systole. And here are 4 examples of when you can use M-mode. As we showed you, across the left ventricle in its short axis, but also across the aortic valve to measure the aortic root and the left atrium. You can use it also on the right ventricle to measure the tricuspid annular plane excursion during systole, as well as across the mitral annular plane to see again its excursion during systole.
So in summary, there is a number of different applications for the M-mode. Now, we've covered a lot of stuff in this chapter. We've seen all the modalities, we've looked at the scanners, now you know how to use the machine. The next step will then be to show you how to image.